when we thought about how we go about um, doing this help change thing, this change making thing, we realize it really starts with the foundation of education. So, again, thank you, Dr. Whitmore, for being here. And I'm super excited to learn from you. So, thank you.
Hi, I'm Corrie Whitmore. I think everyone who is here was here. So I teach health policy, among other things, at the university. And Annette invited me to be here to talk a little bit about making health policy, how health policy gets made. I have an hour, which is a kind of intimidating amount of time, but we'll make sure that we pause often so folks can make any connections they want to make to the work that they're doing or are affected by. So I want to start by talking about what health is. There are two kinds of health we're usually talking about. The first is individual well-being, and the second is public or population health. The World Health Organization defines health at the individual level as a state of complete physical, mental, and social well-being, not merely the absence of disease or infirmity. Public health is focused on the well-being of the public or the population as a group, rather than the well-being of individual people. Centers for Disease Control and Prevention talks about public health as the science of protecting and improving the health of people and their community by promoting healthy lifestyles, researching disease and injury prevention, and detecting, preventing, and responding to infectious disease. The American Public Health Association talks about public health as promoting and protecting the health of people in the communities where they live, learn, work, and play. So public health is focused on improving the well-being of individuals as part of a community, or by the well-being of many individuals at once. Health is recognized as a human right in many countries, but not in the United States. During President Jimmy Carter's administration in October 1977, the United States signed but did not ratify the International Covenant on Economic, Social, and Cultural Rights, which articulated the right to health. When we say it was signed but not ratified, that means the president's delegation approved it, but the Senate didn't consent with a 2/3 vote of support. So health is not a human right that is listed in any of our founding documents in the United States, and we've chosen not to adopt international treaties that recognize that. I want to talk here briefly about the idea of negative constitution, which is the idea that because health is not specifically mentioned in the Constitution, it allows but doesn't require the government to act to protect public health or to provide healthcare services. That's the negative constitution. It's not there, so it's optional, not required for us to provide health. With some exceptions under the Interstate Commerce Clause, health is one of the powers deferred to the states. So states have the option of taking up the right to healthcare themselves. Not something that we're seeing, but they could. Under the Interstate Commerce Clause, the federal government regulates things like drug production and transportation. So rather than letting each state review the safety of, say, a new vaccine, that's done at the federal level. States are responsible for things like medical policies around medical licensing, and they have what are called police powers for health, which means they're legally permitted to enforce health policy. Within states, lots of things like food safety inspections are deferred down to the local level. So because it's not specifically listed in the Constitution, health isn't something the federal government feels obligated to protect or provide. That means it's delegated to the states, who have some specific responsibilities around licensing of healthcare professionals, regulation of medical facilities, and things like that. And then some of those powers are deferred down to local or municipal or county or borough government. In Alaska, our Constitution was one of the last written, and Article 7 declares the legislature shall provide for the promotion and protection of public health. But that's pretty broad, and it's been interpreted in many ways. And at this point, health is not considered a human right in Alaska. And the idea that the legislature shall provide for the promotion and protection of public health tends to be interpreted as we'll have a public health nursing program and we'll provide health education around sexual health for teenagers and that sort of thing. So I'm talking about health policy. First, I defined health. Next, I'm going to define policy. The policy is a guide to action. It helps us make decisions about the amount and allocation of resources. Policies reflect the priorities of decision makers. Another definition of policy is that it's a standard set of principles that guide a course of action. Public policies are established by the government, and private and institutional policies are created by organizations for institutional use. The one thing that definition does well is that it points at the fact that there are many different levels of policy. We have federal policy, we have state policy, we have local governmental policy, we have organizational policies, we have rules, there are all kinds of policies. And it's important to remember that a society's policies reflect its values. As Ruger says, policy change requires a moral vision. We have to know what we want to see and how we can move our society or our organization towards it. When I teach my health policy class, early in the semester, I ask students to reflect on policies that have influenced their lives. And many bring up health insurance policy. It's a great example for more reasons than the students first realized. The policies or documents issued by the insurance company describe the course of action they'll take to reimburse the cost of healthcare. That's an organizational policy. The federal government, through the Affordable Care Act, has some regulations for insurance companies that did away with lifetime limits. That's an example of the way a federal policy is affecting health. If they have employer-based health insurance that they have their health insurance policies through, someone in the workplace or a committee in the workplace selected a policy, and so their organization made that choice, and their organizational policies around benefits guide what's covered, what isn't covered, and who pays what. For public health insurance programs like Medicaid, Medicare, and the state children's health insurance program, which in Alaska is Denali Kid Care, their policies specify who is eligible and what services they'll cover. Those eligibility criteria and some of those exclusions are set in state policy or laws. And then different healthcare providers have individual organizational policies around services they offer, their prices, and how their billing is done. There's lots of different policy levels that health insurance policies interact with. I want to stop and make sure this is making sense so far. Does anyone have any questions or comments?
I don't see anyone writing in the chat, so I think you're good to go.
All right, I've lost the chat in my 27 windows that are open, so please flag for me if there are questions or comments, and please feel free to have questions or comments. I'm happy to respond to them in the moment or at the end. So policy can be a little dry, and I feel like we're in the driest part right now. What it is, what it affects. Because when we start thinking about policies, something that drives choices and that affects people's lives, it doesn't feel as dry anymore. But we're getting there. I want to mention that legally binding public policies or governmental policies fall in three categories. The first is legislation. This is statutory law created by a legislative body. The second is regulation, which adds specifics around legislation. How will this new policy be implemented? Will there be enforcement? What will that enforcement look like? Are there going to be penalties? What will penalties look like? All of those things. And then there's litigation, which involves the body of public policy created through judicial decisions. Probably one of the more famous examples of this that people know is Roe versus Wade. So abortion was outlawed, and then the judicial decision said, actually, that's a healthcare service that must be provided. Similarly, Brown versus Board of Education. There was a law segregating schools, and then a judicial decision overturned that law and created a different public policy for integrated. That's legally binding public policies. We also have non-legally binding policies. These are things like organizational policies outlined in employee handbooks, operational plans for things like how hospitals run, and rules, which can be made at many different organizational levels. These policies are health policies if they're related to protecting or promoting the health of the population. Lots of different levels of policy exist. They come into being in many different ways, and they can be influenced in many different ways. If there's something that's legal, a legally binding policy, a state law, affecting that is going to look different than affecting something that's an employer policy in your company handbook or a rule in a facility you use. So lots of different levels of policy, which means the levers to change them look different as well. I'm talking specifically today about health policy. I want to talk a little bit about what makes something a health policy problem. So first, it has to be related to health. It needs to be connected to morbidity and mortality, quality of life, and other topics that really fall under the 10 essential public health services. So for it to be health policy, it has to be policy that affects health. And you can apply that pretty broadly. There's a lot of different policies that were not created as health policies that have health impacts. The transportation policy many times is also health policy because it affects pollution levels, it affects the availability of public transit for people to get to doctor's appointments, school, things like that. It has to be related to health. It has to have a problem in it. So it's a health policy problem if it creates something negative. It reduces the quality of life. It increases pollution in the neighborhood. It increases morbidity and mortality, by which I mean illness, disability, and death. And so that's a health problem. And it's a health policy problem if there's a policy lever or lots of policy levers that can affect it. I'm pausing here so folks have questions or comments. Put them in the chat or mute. Now I want to talk a little bit about context. Many types of context inform policy. First is social. This is dynamic and it includes population demographics. So this is things like the percentage of a population that is elderly, or the percentage of a population that's under age 5, the ratio of 2 income families to 1 income families to no income families. Things like communities' views on LGBTQ rights. These are social contexts that may influence policy. Economic context includes inflation, unemployment, taxes, and resources for the government. So these economic policy contexts influence individuals in a community and the community, but also the government. Because when there are resources available, it's easier to pass health promoting policies. And when there are fewer resources available, or we're trying to, say, cut taxes to individuals, then we have less resources available. And so that's going to drive certain policy choices. The governing context is also important because a lot of the policies we talk about are those legally binding policies. Federal policies, federal government, state level policies, they're municipal or borough policies. And the way the authority is dispersed among the many actors in those different systems is going to influence the policies that result, the ways they're implemented, and how they're enforced. The state and federal systems have authority for different things. And then even within the system as it is, we often see different contexts. For example, a different president or different presidential administration is going to create a different policy environment at the federal level. If we have a divided government with, for example, a Republican president and a Democratic Senate and House, that's a different political context than if we have an undivided government where everyone representing the same party. And then cultural context matters. This can be political culture as well as our culture, values, beliefs, attitudes, and morals. So all of these things contribute to how policy comes into being, what that policy is, how it's implemented, and how it's enforced, or if it's enforced. And those contexts are complicated. So to understand context, it's useful to talk to stakeholders. So who are stakeholders? They're those affected by policy, those responsible for making or implementing the policy. We call them policymakers sometimes. People whose jobs or lives might be affected by the policy, community members and leaders, neighborhood associations, professional organizations, different kinds of networks, community leaders and influencers, health departments at the local, state, or federal level, interest groups like like different business, activists, or academic groups, resource providers, people who provide services or people who provide funding to support services, schools, and evaluators are people who are looking at impact of policy. Really, you're stakeholders. And it's important to remember that policymaking can be influenced at many stages of the process. So during the decision to create a new policy, change an existing policy, or cancel an existing policy. During the process of putting that into being, when we're making decisions about how we're going to implement that policy, we're making decisions about if or how we're going to enforce that policy. And it can be influenced throughout that. So now let's talk a little bit about how policy is made. So we can start talk about how it can be influenced. We're going to have a brief break from listening to me to listen to someone else. Can you see the Schoolhouse Rock screen? I'm going to hit play and you'll have to let me know if you can't hear it.
Woo, you sure gotta climb a lot of steps to get to Washington. Well, I wonder who that sad little scrap of paper is.
I'm just a bill. Yes, I'm only a bill. And I'm sitting here on Capitol Hill. Well, it's a long, long journey to the capital city. It's a long, long wait while I'm sitting in committee. But I know I'll be a law someday. At least I hope and pray that I will. But today I am still just a bill.
Gee, Bill, you certainly have a lot of patience and courage.
Well, I got this far. When I started, I wasn't even a bill. I was just an idea. Some folks back home decided they wanted a law passed, so they called their local congressman, and he said, "You're right, there ought to be a law." Then he sat down and wrote me out and introduced me to Congress, and I became a bill. And I'll remain a bill until they decide to make me a law. I'm just a bill. Yes, I'm only a bill. And I got as far as Capitol Hill. Well, now I'm stuck in committee, and I'll sit here and wait while a few key congressmen discuss and debate whether they should let me be a law. How I hope and pray that they will. But today I am still just a bill.
Listen to those congressmen arguing. Is all that discussion and debate about you?
Yeah, I'm one of the lucky ones. Most bills never even get this far. I hope they decide to report on me favorably, otherwise I may die.
Die?
Yeah, die in committee. Oh, but it looks like I'm going to live. Now I go to the House of Representatives and they vote on me.
If they vote yes, what happens?
Then I go to the Senate and the whole thing starts all over again.
Oh, no.
Oh, yes. I'm just a bill. Yes, I'm only a bill. And if they vote for me on Capitol Hill, well, then I'm off to the White House where I'll wait in a line with a lot of other bills for the president to sign. And if he signs me, then I'll be a law. How I hope and pray that he will. But today I am still just a bill.
You mean even if the whole Congress says you should be a law, the president can still say no?
Yes, that's called a veto. If the president vetoes me, I have to go back to Congress and they vote on me again, and by that time you're so
By
old.
that time, it's very unlikely that you become a law. It's not easy to become a law, is it?
No, but how I hope and pray that I will. But today I am still just a bill.
He signed your bill. Now you're a law.
Oh, yes.
Little Schoolhouse Rock to keep us engaged. So that's a fairly old video clip, but it still describes accurately what the process looks like. Process inside Alaska looks a little bit different. And I think somehow it's worth talking about because those similarities and the differences. So Alaska has a Senate with 20 elected senators, and a legislature with 40 elected legislators. All bills or proposed legislation must be introduced by a legislator, a legislative committee, or the governor through the rules committee. So if you're someone who wants to create a law, which I know Annette at least has some experience working around, you can bring the idea forward. You have to bring it to someone who has the standing to introduce the legislation. So once a bill is drafted, and that it goes from an idea through like the legal department into a bill, then it's introduced and read for the first time. We have a 3-reading system. So the first reading is they just sort of accept the bill and refer it to a committee or committees. Alaska has several committees: education, finance, health and social services, labor and commerce, community and regional affairs, resources, rules, state affairs, and transportation. If a bill is looked upon favorably by people in power at the time, it's likely to get just maybe one committee assignment because each of those committees stretches out the process. Committees, so a bill is referred to a committee, it goes to its first committee, and the committee can have a public hearing. They can combine bills that deal with the same subject or introduce their own changes to the bill as proposed amendments. If they vote on it, it moves on to the next step. If they don't vote on it, it languishes. That's what he was talking about, dying in committee. So bills can die in committee. They just get stuck and aren't able to move forward. The language specifically says they may hold hearings on the bill, they may propose amendments, and they may move it forward for a second reading. The second reading goes back to the larger body. Proposed amendments are voted on. And then it's moved to a third reading, which can happen the same day or the next day the legislature convenes for a vote. Once the third reading happens, it's voted on by the body as a whole. So that's all 20 senators or all 40 legislators who can choose whether to pass the bill or not pass the bill. If it's passed in the Senate, it has to go through the same process in the legislature and vice versa. Sometimes they're introduced in both places at the same time, and so they walk through the process together. And if those bills that are voted on and approved pass but are different in the Senate than they are in the legislature, then they have to go to conference committee where they work out the differences and choose a final version of the bill. It gets voted on. And assuming we make it that far, and that is quite the assumption, then it goes to the governor. Unlike what we saw in Schoolhouse Rock, the governor has 3 options. The president has 2. They can sign the bill or veto the bill. In Alaska, we have the option for the governor to sign the bill into law, to veto the bill, or to allow it to become a law without a signature. So if they aren't going to veto it, but also don't want to approve it, they can just do nothing and it becomes a law after a period of time. If they veto a bill while the legislature is in session, they bring together a joint session, all the senators and all the legislators, to see if they can override the veto. If they're not in session at the time, it waits. It takes 2/3 of all 60 of them, so 40 votes to override the gubernatorial or governor's veto. Or it takes 3/4 of them if it's an appropriations bill or a bill to raise revenue. So a bill can pass with a simple majority in both houses, but if the governor doesn't approve it, it requires a stronger majority to be able to move forward. I think that when I talk about this with my class, I talk about chutes and ladders, the children's game, because it feels like you're moving forward and then you get stuck in 3 committees, back to the bottom. Or it gets voted out of committee, but in the second reading, the amendments aren't accepted. And so it feels like there's a lot of places where this policy can process and get bogged down at the state level. So we know from Schoolhouse Rock how we get a bill signed into law at the federal level. Talked a little bit about the state level. We also have policies at the municipal level that move through the Anchorage Assembly. I mean, I'm in Anchorage, that's what I'm talking about. They look different in different places. So at the assembly or municipal or county or borough or wherever you are, whatever your local government is. And then there's organizational policies and rules within that. And they come into being in lots of different ways. Often those organizational policies are influenced by laws. So we have some federal employment laws that tend to be reflected in employee handbooks. Things that are allowed, things that aren't allowed, what our expectations are for our employees, and what our employees' expectations can be for us. So those different levels of policy interact, but they are still somewhat distinct. If you violate a policy in an employee handbook, you're not going to get arrested, for example. However, if you break a law, that's one of the consequences that can happen, depending on what the enforcement strategy for that law is. There's lots of different levels of policy, and they can be influenced in different ways. But here's the fun part of this talk, which is what can I do to shape policy? And I teach this in my class. We have an article that talks about, by Laverack, that talks about more than 20 ways to influence the policy process. And I've pulled a few of them out here. You can vote if you're eligible to vote. You can sign a petition. You can protest or demonstrate. Contact your elected officials by letter, by email, by phone call, by visit, and attend public meetings. There's lots of different levels of public meetings you can attend. You can attend your community. I'm in Anchorage, that's the examples I'm giving. You can attend my community council meeting. I can attend the Anchorage Assembly meeting. I can attend a public testimony or a public meeting from the state legislature. I can go to a town hall with one of our senators when they're in state to influence what's happening at the federal level. I also have the opportunity to provide public testimony. So during political issues I feel heated about, I call and leave messages or send emails to my elected officials a lot of the time, let them know what I think, let them know what I want them to do. That's different from providing public testimony. Public testimony is more formal. There's a specific time they want to take this testimony, and usually a time limit. So when I've given public testimony for the state, for example, the state budget, you have 3 minutes. You go to the legislative chamber, you line up. This was all pre-COVID, and go in and say what you need to say for those 3 minutes. There's usually an opportunity to provide written public testimony or telephone testimony, recognizing that we're a big state as well. There's also the option of running for office. I encourage you, if you're interested, to think about your community council, your assembly, running for statewide public office. One of my colleagues, Liz Snyder, former colleagues, I guess at this point, I used to share an office wall with her at UAA, but now she's Representative Liz Snyder, and she's in Juneau representing East Anchorage rather than at the university teaching public health with me, because she saw policy problems that she was concerned about. She thought she had something valuable to provide there. And so she ran for office and was elected to go to Juneau and advocate for the things that her constituents need. You can also participate in publicity campaigns to raise the profile of an issue. You can propose policy. Again, you have to do that through a legislator or legislative committee at the state level, or through your federal representation, federal level. If you're talking about an organizational policy within your workplace, within your kids' school, within your classroom, the process is probably simpler. So there's lots of different places you can propose policy. And depending, if you are someone who is affected by a public policy in a way that is unfair or unconstitutional or feels illegal, you can take legal action to stop a policy. That's something that has changed laws. When we talk about sort of that judicial impact on policy with Brown versus Board of Education. And in Alaska, there's been several other examples of that. Times we've had lawsuits filed that have gone on to change policy and its implementation and enforcement. There's lots of different ways that individuals can affect the world. How can you change the world? There's lots of ways, but one of them is by influencing policy. Laverack's list included these. He also talked about making trouble, strikes, revolts, riots, insurgency. We usually only see these strategies to influence the policy process in conditions of extreme inequality when people feel unable to participate in the political decision-making process. When people do feel like they have options for participation, the other 19 ways are more common. Beyond what's on this slide here, we have community empowerment work, either as a facilitator or a community member. We have joining an action group or identifying and providing evidence to shape policy. So participating in research or providing data in other ways. You can write a discussion paper or a white paper. You can participate in implementation. Depending on the context, you can provide technical assistance to people who are writing the policy or putting together the implementation plan. There's lots of different levels that you can influence policy change at. Questions, comments? Trying to remember to do that periodically. Okay, so if you decide that you want to influence the policy process, I think it's important to start by clarifying what the problem is. If you identify a problem that you think either is policy has created or that could be solved with policy, and you can identify the root cause and what its effect is on the population health, you have a really good place to begin to take on a policy change. You want to recognize that problems are unique to their context, so understanding context matters too. Once you understand the policy, you're well situated to identify policy levers that can make a difference. So there's lots of different ways you can do that. Think about the policy you want it to be. Think about the implementation. Think about the evidence that you could use to inform the policy. And here is one of my side soapbox issues, which is that evidence-based policy is sort of the buzzword of the decade, which is we all want evidence-based policy. We want to do things that are proven to work. We want to do things that are proven to be cost-effective. And that's important. But evidence-based policies and evidence-based practices come from practice-based evidence. There are lots of kinds of data we should be looking at as we think about the evidence for or against a certain policy choice. We want to make sure we're looking broadly there. We also want to think about health equity, optimizing the conditions in which people are born, grow, live, work, learn, and age. We want to think about health disparities. Are we seeing disproportionate impact? Are we seeing better or worse outcomes for particular groups of people? Because if we are, we need to unpack that a little bit, figure out why we're seeing those disparate impacts and what we can do to improve equity. And then think about implementation. Who's going to be affected by the policy change? How will it be implemented and how will it be enforced? Once you've thought and clarified your understanding of the problem and its context, and you've thought about what changes you want to see, it's time to choose your strategy. There's some research on what kinds of communications are compelling to elected officials. There was an article published in 2010 that looked at the communication strategies used by local advocates of clean indoor air legislation to reach elected officials. They collected data from both the advocates and the policymakers to see what each side thought was the most effective driving this policy change. And they found that polls showing public support, so being able to say a lot of people agree with me, majority of us believe that this should change, is powerful. So is contact from constituents. You're a constituent, I'm a constituent, and we have the ability through that public testimony and through that ability to contact our elected officials through letters, emails, phone calls, and visits to really make the argument for the policy changes we need to see. Sharing personal stories was also highlighted as something that was really effective. You can talk about how a health policy or the absence of a health policy affects your life or the life of someone you care about. That's powerful. They also recommend framing the policy change you're looking for as supporting the needs of the majority. So in this clean indoor air example, they talked about highlighting that 80% of the population is non-smokers. And so making this change supports that 80%. Policymakers also found some kinds of data effective, things about levels of disease among bar workers, the inadequacy of ventilation systems, and the effect of smoking bans in other businesses and cities were considered helpful. I think what you need to see here is this idea that talking about levels of disease, so what are the negative impacts of the status quo? What potential mitigation strategies exist and how well they're working or not working? That's the inadequacy of the ventilation systems. And then being able to point to other places that say that, they're out ahead of us. This policy they've adopted is doing well, and look at the positive impact it had. Or we're doing better than these folks around this, and let's build on that and move forward, can be compelling. So interestingly, those are the things that both the advocates and the policymakers thought were effective strategies for individuals to shape their elected officials' behavior. There were some disagreements about newspaper ads. Policymakers thought they weren't effective, but advocates thought they signaled access to resources. They also disagreed about the value of petitions. Policymakers dismissed them as too easy to be meaningful. It's easy to get someone to sign, even if they don't really care about an issue. But advocates thought they were a useful way to collect contact information to use for future efforts. And then they had this disagreement about the utility of formulaic communications, the sort of form letter, form postcard, form email kinds of communications, because they sort of stripped out that individual communication, individual story, but volume still made an impression. Advocates were more focused on the quantity of the contacts. We had this many postcards sent and this many emails. While policymakers talked more about the quality of interactions as being important. That's those conversations. If you were really able to have a conversation with your elected official, if you're able to visit them in person, if you're able to have an email exchange back and forth, that's powerful. This article also specifically noted that a compelling story is a powerful advocacy tool, and that elected officials preferred engaged dialogue to a prepared statement. It's like, show up, be a human, tell them your story, have a conversation, and that can shape the policy that your elected officials advocate for. When it comes to the evidence that is considered in real-world policy settings, we see that there is a benefit to having sort of quantitative, scientific, numeric data, as well as qualitative evidence. But stories are also really effective and powerful in shaping the way your policymakers think about things. So our witness accounts, expert opinions, epidemiological data, so data about what the population impact of something is, research-derived data, so looking at what works or doesn't work, or what the impact of certain things are, and state-by-state comparisons. So all of these kinds of things can be really valuable. If you have the ability to pull up epidemiologic data, that's awesome. But if what you have is your story, that's very powerful. So let's say you've identified a problem you want to try and create a policy change around. You've thought about the context and the things that affect it, and you've figured out that this is a problem that should be tackled at, say, the state level. You're getting ready to reach out. The work that I've reviewed suggests that you focus on visualizing your audience. Who are you communicating with? If you have something in common with your elected official or something that you think will make you more human to them, that's important. You also want to figure out who you are for the purposes of this document. Are you writing as a citizen? Are you writing as a professional, like a teacher or a nurse? Are you writing as a parent? Are you writing as a regular old constituent? And share that. And then just be brief and clear and avoid jargon. Tell them what they need to know. You don't have to sound highfalutin. You don't need long words or long email. You can just tell them what you think they need to hear. It's helpful to, in your communication, tell them about the problem. Why is it important? Why is now the right time to change it? Who cares about this? And who could make a change that will address it? Essentially, we're talking about how the problem occurs, how serious it is, its outcomes and impacts, and the 5 W's. Who is affected? What contributes to the problem? When and where is the problem most likely to occur? And how big is the problem? It also helps if you can state the policy change you want to see, preferably a limited menu, 1 to 3 policy actions that could address it. And make your case. Describe and display relevant data. Your story can be that data. And talk about the impact. What would be the result of them taking action? What would be the result of them not taking action? There's lots of ways for you as an individual to affect public policy. You can speak up at public meetings. You can take on a leadership position in your community or run for elected office. You can make public comments or contact your elected officials. And here I've made myself a list. I wanted to make sure that I shared with you that could include things like your community council, your assembly representatives, the mayor of your town or community, your state senators, your state legislators, the governor directly, our state senators, which for Alaska are Sullivan and Murkowski. And they're representing Alaska on the national scene. And our congressman, Don Young, all of whom are interested in what their constituents think. There's lots of things you could do. I want to share a few resources that people who are interested in policy might find useful. The first is the National Center for Health Statistics, which is through the Centers for Disease Control and Prevention. And it's a health statistics agency providing data to identify and address health issues. Their goal is to provide a complete picture of the effects of major policy initiatives and help track the nation's health status and changes over time. And you can look at Alaska, you can compare Alaska to other states, you can look at Alaska compared to, say, the federal average, which is useful. They focus on health status and determinants. So that's life expectancy, infant mortality, causes of death, things like that. Healthcare utilization, so childhood vaccination, use of prescription drugs, unmet medical needs. Healthcare resources, such as the availability of dentists and the use of long-term care facilities. And then cost data, healthcare expenditures and payers. This can be useful when you're looking at something the CDC recognizes as a health issue that has policy levers. The community toolbox at University of Kansas is also helpful. It goes beyond defining policies to discuss the unwritten guidelines that contribute to policy. It talks about the assumptions about the way things should be, what works, what's good for the community, and how you can try and change policy. They specifically want to empower everyone to change policy. And to do that, they talk about when policies are most likely to be changeable and what the process for moving change can look like. This is just on the web, and I can share a resource list in it if there's a way to host that or share that. There's also state level data that could be helpful. One source of that is the Alaska Native Epidemiology Center. The state of Alaska has many resources that I would normally have showed you a picture of, but because of their web attack, they're not currently online. So it felt unfair to say, here's what you could use in another universe. Similarly, you can reach to national organizations with an interest in supporting local policy. For example, when the Smoke-Free Alaska bill passed several years ago now, the American Lung Association was pretty involved in the strategy and advocacy effort around that because they wanted to, their national organization was happy to support local. I also wanted to draw your attention to this document about the legislative process in Alaska. It can be kind of confusing what the process is, and it just walks you through it. I gave you the 2-minute version of this, but it's a several-page PDF document that the legislature provides online to help folks who are interested in trying to drive policy change that way. So I went after this from the sort of dry policy side of things, but I know that many individuals have made powerful policy change efforts. I wish I had invited some of them to talk with me about it in this context, but there's a lot that has happened and that demonstrates sort of the power of individual efforts to shape policy work. Alaska, especially, is a state where it's pretty easy to get the attention of your state representative or state legislature because we're a small state, because we live in small communities. I live in the same neighborhood as one of mine, so I see her walking her dog sometimes. Easy to bring up things I think are important. I know I'm not the only person who has that relationship. Does anybody have any questions for me or examples they want to share about how they've been involved in policy work?
I have a question. So when you talk about all the different ways that people can be involved in policy change, I know that one thing that makes Alaska really wonderful being so small is that things are accessible. But another thing that can sometimes happen is that like there can be kind of adverse responses, in an at-will employment state, for example. So how do you do like a risk assessment when deciding, what to put on public record or what to talk about? Because I know for some of the people I talk to, they're just kind of in this disempowered, afraid kind of space. How can we acknowledge that and like take back our power to be able to use our voice? Like, did that question make sense?
I think so. So risks are real, and I want to encourage people to make their own risk assessment. I'm technically a state employee, which means I have to be a little bit careful about about my own political activities. I'm careful, and for me that looks like not using state resources. So I don't use my office telephone. I don't use the copy machine at work. I don't use my work computer to send in those public comments or to do any of political activities. But I also am, and when I give public testimony, I always introduce myself as a constituent and a private citizen. So I'm not there wearing my university hat. I'm there wearing my mom hat or my community member hat, my, whatever it is that I think I bring to that conversation. For folks, but it depends on who you're concerned about repercussions from, right? If you work for a small business that you think is likely to take your political speech as some kind of threat, there's different consequences than there might be for me who works for state government, where there's a pretty clear, like, bureaucratic, here's what it is, here's what it isn't. And in an at-will employment state, you can be let go or fired from your employment for anything that isn't covered under specific protections like race, religion, all of those things. And so thinking about what actions you want to take and the risk associated with them is smart. I do think in general, there's more and less public versions of this. Voting is something that is confidential. You can do that without having to tell anyone who you voted for. You can also potentially attend public meetings in your community without identifying yourself with your employer as a private citizen. Protesting and demonstrating gets a little trickier because different employers may have different responses to that. I mean, it's protected First Amendment speech, but we also know that not everyone wants to go to court over it. So I think weighing the risk of different things is useful. And I would say that for many people, if you're careful to distinguish yourself from your company, so who you're representing, just yourself, and to try and provide data, to provide support for a particular policy approach, to highlight a need, is something that should be possible. Does that answer your question, Annette?
It does, and I appreciate that. When it comes to the idea of sharing, public testimony, let's say on a bill or on an ordinance or something like that, I think a lot of people don't realize that you can call in or write in more than once. And so as something moves from committee to committee, do you have an idea about how often it's okay to do that? Or, does that make a difference? Or, do you do just the one time and call it a day? Or, a lot of people are like, I don't want to be the one that calls every single day and takes their time. And they're like, oh, that guy. But like, what's the line as far as like the number of times that you reach out for something?
I'll tell you that Lisa Murkowski's staff recognizes my name because I call often enough.
That's awesome.
And so I think from my perspective, anytime something moves, anytime there's a decision to be made, it's useful to reach out. But I also am not a perfect advocate either. I'm a person with a busy life. And so when I'm more preoccupied with other things, I do less advocacy work. Honestly, the madder I am, the more likely I am to call and leave public comment. And so I think anytime there's a shift, there's another vote, it's moving to a committee or out of a committee, or anytime you want someone to do something, it's useful to reach out. I want you to vote this way or that way. I want you to consider introducing this bill. I want you to lean on your colleagues who are on that committee to release it from committee. Anytime you're asking for an action, I think it's appropriate to call again.
And you mentioned the 5 W's, but in general, it doesn't have to be really long, right? Like, what's the shortest email or like the shortest phone call that you shared?
So for me, I'm going to know more about my politics, but nothing you couldn't have guessed. So when there was,
oh, sorry, I didn't mean what is it? I meant like how long was it?
Right, but yeah. I'm just going to give you an example.
Okay, all right.
For me, like the one sentence is probably enough. I would leave very short voicemails. It was like, I believe you should vote no because, and that's just one sentence. I believe you should vote yes because, and I think especially for our federal representatives, at a certain point, they're just counting comments as pro or con. And so just being counted is what I was shooting for with those really short communications.
I want to leave time for someone else to ask a question or share a comment. And so I just really quick want to also share another resource. And so this is the Alaska Constitution, a Citizen's Guide. And some super cool folks on the state level made this. And they just have free copies available until they run out. So if you go to the Anchorage Legislative Information Office, if you're in Anchorage, which is the Wells Fargo building off of like Minnesota and
Benson.
Northern Lights, Benson, one of them.
Benson.
I get them mixed up. Thanks. So Northern Lights and Benson. Then you just go into the first floor, or you can call them and just ask for this and they'll just give it to you. Or you can call and ask them for it. And I don't know if they have them at all of the LIOs or not, but it's super helpful because it has the law, but then it also has an explanation of like why it was made that way and what the intention was behind it. So one good thing about being such a small state and such a new, in terms of like the number of people and such a new state, is there are people who are alive who still like help make the Constitution so we can have these conversations, which is really cool. And so they like put this together so we could always know why the rules are and the laws are the way that they are. Because it's important to also understand the why behind something. So I just want to offer that as a resource.
Absolutely. And I want to highlight, I guess this was a pretty, what is policy? Why does it exist sort of presentation, but any decision that someone else makes that affects your life is basically a policy. And it's worth figuring out who has the power to make things better for you or for other people or for the community that you live in, and figure out how you can do that. And even if you only do one tiny thing, I find that when I reach out like that, I feel a little bit more powerful, feel a little bit less stuck. And I feel like I've sort of done my one tiny thing to make the world a better place, even if I don't have it in me to champion a whole new bill or a whole new law that around that particular issue.
Legit, all those little things totally make a difference. And in Alaska, just for some context about all those little voices that together make a difference, the village formerly known as Barrow, now known as Utqiagvik, was changed. That name was changed off of 6 votes. And I don't know if you were following that. I was, but it was so funny to me how after it was like, yep, we're going to change the village name to Utqiagvik, a bunch of people that didn't vote were like, this is unacceptable. I do not appreciate it. And I was like, but you didn't vote though. So like, it's going to happen. And so it twice now in the part that I was like, oh, we have to talk about this, twice in 20 years, 15 years, a state elected official was decided by a coin flip because it was a tie. Mm-hmm. And in one case, the winner went on to become the Speaker of the House, which is a really powerful position at the state level. And so the winner of a coin toss ended up having like one of the most powerful positions in state elected office. And I was like, are you kidding me? Are you kidding me? In Alaska, this is being decided by a coin toss. One other person voting could have made a difference. So anyway, just want to encourage folks to please feel empowered enough to use your voice, because it does matter, even if it feels like it might not.
Absolutely. And I think being able to say, here's the problem, and here's why it's a problem, and here's a way that you could make things even a little bit better, when you frame it that way and reach out to someone who has some power, it can be really amazing. It can sort of take on a life of its own, which is why I really framed this presentation around that. I think individual voices make a big difference. That's true everywhere, but it's especially true in Alaska.
Thank you so much for being here. I know I learned a lot, even though I've been part of this process before, but I just super appreciate your time and willingness to chat, and the idea of thinking strategically about like, what can we do? I super appreciate it. Thank you so much.